Clark. How are you?
So good. How are you?
Excellent. You are such a great underused addition to many cancer patients' lives because you are a physiatrist.
Yes.
And I don't think people really know what a physiatrist is. So I would love for you to first kind of give us the like
Who am I?
simple, yeah, who are you? What do you like? What do you do?
Right?
Start there with us.
Yeah, because it's not just a psychiatrist that is being mispronounced, right? And people don't know, A, they don't know that we exist, and B, they don't know that they need us until they really need us. So physiatry can be called a lot of different things. And I think that's where some of the confusion comes in too, because we're physical medicine and rehab docs or physiatrists. And sometimes we call ourselves cancer rehab docs or sports medicine docs or, you know, all sorts of different names that we'll use. But at the basis, we are neuromusculoskeletal docs. So we look at the human body and we look at the systems like the nerves and the muscles and the joints and the bones and all of those parts and pieces that keep us moving and keep us doing the things that we want to do. So with that basis, we go off into a lot of different directions, whether it's people who care for spinal cord injury patients or patients after stroke or patients after sports injury. And then for me, it's caring for those patients after a cancer diagnosis or treatment, and looking at how to keep them up and moving and functionally, what are they doing?
So would you say when you meet patients, a lot of times they're coming to you maybe for something specific cancer related or was tied to a treatment or a surgery, and they're coming to you for this thing. And then your approach is, but let's look top to bottom. That's kind of correct from knowing you.
Yes, that is very correct. Because how often is it just one part of the system that's impacted by something, right? I mean, we're just big
Right.
machines.
Right.
And if part of the machine is broken, you've got a whole piece and function of the machine that's not working right. So yes, the other part of it too is that sometimes the cancer treatments and the things that we end up doing to you along the way exacerbate that old knee injury or exacerbate that shoulder injury that wasn't really bugging you before, but man, now it's a real problem. So yeah, there are the things that we make worse with our treatments, and then there are the things that we cause with our treatments. And so yeah, that really just throws a wrench in our whole system.
And I love that your entire visit with a patient or another, a specialist like a physiatrist in cancer rehab is looking at the patients more for physical function versus asking the, hey, how are you? I'm fine kind of commentary. So tell me, what would you say is one of the number one things that you treat, or let me say this. What is one thing that you feel like you say to all of your patients? Like, what's your kind of like Dr. Clark's number one tip or strategy for everybody that they can take from our video today?
The number one tip or strategy, keep moving. That's probably my number one tip and strategy. We are a machine. And so obviously when someone's coming to me, we're looking at what's keeping them maybe from doing what they need to do. But man, use it or lose it. I mean, if we don't keep moving forward, it's not just, especially with our cancer population, it's not just that we stagnate. It's that we have the tendency to start kind of tripping backwards. So it's the hard to believe, and a lot of times it's a hard pill to swallow to tell people, move more. And they go, I feel awful. You're crazy, lady. They go, no, move more.
Yeah.
It's not just that it makes you feel better. It's that you have to keep moving forward. So I think that's probably the overarching goal that I have for so many people. We'll figure out a way. If there's a roadblock, we've got to move through the roadblock to figure out a way to just keep moving forward. One day, minusculely more than the day before, but overall, we're making progress.
Yep. I love that. Honestly, I mean, I tell everyone, this movement is the spice of life.
Amen.
Gets everything in. Thanks so much for joining us today. Hope you have a great rest of your day.
Thank you.